Some 3,000 chief executives from 125 countries are gathered in Los Angeles for the annual meeting of the Young Presidents Organization. Now, among them, Dr. Patrick Soon-Shiong. He's the CEO of California-based Nant Health. His company has new software that consolidates and integrates medical records, scientific data, and other information that he says could revolutionize the healthcare industry and potentially save lives. Our own Tyler Matheson sat down with Dr. Soon-Shiong at the YPO event, discussing how the program works and how it can help.
Susie, thank you very much. Dr. Soon-Shiong, welcome. Good to have you with us. Let me start with a big, broad question. What is America doing right, and what are we doing wrong in healthcare, its delivery, what we're spending on, what we're investing in or not investing in?
Well, what we're doing right, we're still the innovators of the world, right? I think the investment that has been made in research and science still means that we are on the cutting edge. What we're doing wrong is because we know so much information, which can make either a difference in terms of whether this patient lives or dies, we're not getting that information out to the patient and the provider in time. And the reason we're not doing that is because we have these systems that don't talk to each other. And I think if you follow what you do, you don't know when your doctor and your primary care physician in the hospital and the clinic, or if you go to a different city, has any access to your information in real time.
And one of the things that I know you've been working on, actually an initiative that you've brought out just in the past few days, maybe even earlier this week, is one to bring together medical records and to unify them in a way that could help with that.
So the best way to describe what I've been doing in the last decade is understanding we have a blockbuster model and you have the Netflix model. So we basically created now the Netflix of healthcare, so to speak, where we can now take every medical record, regardless of where it's generated, every medical device, 6,000 of them, and actually integrate that in real time in the cloud and create what we call an operating system, a clinical operating system that can now go between the mobile device and the cloud and have accessibility and secure health information real time for both provider and doctor, no matter where you are.
You also earlier today were talking about the realities, not just the potential, that big data and understanding it has to change the lives of people who are afflicted with some of the world's great afflictions, blindness, Parkinson's, autism. Tell me a little bit about that marriage of technology and clinical practice and the kinds of things that you're doing now that the world will see more of over the next decade.
What's going to transform healthcare is big data, but the problem is to actually digest big data in a transparent format that is actionable in time of need. So we just launched our company called Nant Health, N-A-N-T, it sounds hard to read, but Nant stands for nanotechnology, or it stands for Nantan, or he who speaks for the people. And so at HIMSS, which is this big conference, the largest healthcare conference, we launched this clinical operating system to take big data into the cloud and make it actionable in time of need, at point of care, anywhere, anytime. So until you could do that, you wouldn't take advantage of the amazing amount of science that is evolving now to cure heretofore incurable diseases.
Using such things as photonics, I saw an amazing demonstration using the power of light to interrupt some of the brain transmissions that cause the outward symptoms of Parkinson's. A man who was really afflicted stood up and walked normally across a room. It's astonishing.
Well, and I think that's what is exciting, because for the first time we're interrogating how either the brain works, how sight works, how cancer cell works at what I call the atomolar level. So for the first time we can touch and feel the cell in real time at atomolar level. So if we can do that by understanding the mechanisms, we really have a shot now at treating Parkinson's disease, rare diseases, mitochondrial dysplasias, cancer, lung cancer, pancreatic cancer. We have the shot now for the first time.
Dr. Soon-Shiong, thank you very much for being with us tonight.
You're welcome.
Appreciate your sharing with us. Back to you.